Hello and welcome back to the channel. Today I have another special presentation to share with you from inside the Concussion Fix program. For those who are new to the channel, the Concussion Fix program is an online concussion recovery program designed specifically for patients dealing with ongoing concussion symptoms. The program has helped more than 4,500 people to recover from persistent concussion symptoms, even when they've had symptoms for 10 to 20 years or even longer. We do this by teaching people about the systems and dysfunctions that cause symptoms to linger. And then we provide members with a step-by-step action plan to fix those dysfunctions. If you fix the dysfunctions, the symptoms go away. You see, persistent concussion symptoms are not due to ongoing brain injury, but rather they're due to very treatable dysfunctions. Now, the problem is that most healthcare professionals don't have a deep enough understanding of how these systems work or even how involved in PCS they are. So most people never even hear about them. Concussion is highly specialized, and this program was developed in order to bring this specialized knowledge and recovery programming to everyone in the world, no matter where you live or no matter what your access is to healthcare professionals. Now, as part of this program, our clinical instructors provide additional presentations each and every week to our members to dive deep into topics like the one I'm about to share with you today from our functional medicine doctor, Dr. Paul Hrkal, who's going to be talking about concussions and hormones, specifically addressed to women. The title of the presentation is actually The Impact of Concussion on Hormones Throughout a Woman's Lifespan. And in this presentation, he covers everything from menstrual cycles to perimenopause and menopause, and how each of these things impact hormones and concussion recovery. If you're interested in adding the Concussion Fix program as part of your concussion recovery, I've added a link in the video description below so that you can try it out. We offer a full 14-day money-back guarantee, so you can literally try it out risk-free for the next 2 weeks to see if it's right for you. That's how confident we are in this program. The average member sees a 50% drop in symptoms within the first 3 weeks of joining. So if you try it out for the next 2 weeks, we know that you're going to see that it's worth way more than what we're actually charging for it. So without any further ado, I hope you enjoy this presentation from Dr. Paul Hrkal. And if you do enjoy this presentation, be sure to give it a like and share it with someone that you think could also benefit from this information.
So today is a topic that I know it's discussed a lot with me. It was actually one of my 5 buckets as to that held a lot of symptoms when I went through the program. So all about hormones throughout a woman's life. I remember Dr. Hrkal and Dr. Marshall did a presentation in December of 2020, shortly after the program originally launched.
A long time ago.
Yeah, I was on live for it, and I remember it, and I was taking mad notes to share with my naturopath, and it was like huge key to my own recovery. So I'm very excited to hear this updated presentation as well. And I know it is something that comes up a lot. So you should be able to share your screen.
Yes, I'm about to do that, and we'll get going.
All right, over to you.
Alrighty, can you hear and see me okay, Nikki?
Yeah.
Okay, wonderful. All right, let's get right into it. We have a lot of information to cover today. Today's topic is, as Nikki said, probably one of the most common things that I get asked about throughout the course. And actually at the end, I've included some of the top questions that I've received through the program. Each module within the program, each lesson, I should say, you're able to ask questions. So if you have questions, particularly about that topic, you can definitely ask them through direct messaging, through us on the live on the live Q&As is ideal because you're going to get a real-time answer from us. But you can also go in and post them on the newsfeed and actually after each lesson. So that's one way that you can go back and take a look at a lot of the questions that were asked and ask your question. Because a lot of times, because we've had the program going for now going on our 5th year, going into our 6th, we've answered a lot of questions already. And this is one of the most common ones. So I wanted to really take a deeper dive into particularly women's hormones. And my apologies to all the guys out there. There is some information throughout this conversation that I'm going to also refer and is applicable to males, but primarily females. The reality is that majority of the members of the Concussion Fix community are female. And of course, there are some unique hormonal considerations when it comes to women sustaining concussion throughout their lifespan, whether you're in teenage years, middle age, or then going into menopause. So I want to start off with some of the questions that we've received before, and just to give you kind of a taste and set the table for what I'm going to be talking about today. So what about hormones for when you are kind of in that perimenopause, 45 to 55 age? Elizabeth was asking this. Any insights on whether there's a way to know if it's concussion or perimenopause? There is a lot of overlap between certain symptoms, like for example, sleep changes, sometimes thermoregulation. We obviously know hot flashes occur in menopause, but sometimes people struggle with being colder, for example, after a concussion. Could that be hormonal, or is that actually something to do with the central nervous system? Is there a way to treat it, or is it just part of the post-concussion symptom population and just having more complications? So by my hope, by the end of this presentation, you're going to have a much better understanding of Elizabeth's question, because I definitely am going to be addressing it. And then Jules asking, my hormones show low aldosterone, low growth hormone, low T4, which is active, which is one of the thyroid hormones, low vasopressin. You don't have to know all these hormones, but she was wondering, is this contributing to my postural orthostatic tachycardia, POTS? Is this contributing to insomnia? Is this contributing to some of the PCS symptoms? And the resounding answer is yes. And again, that's another thing that hopefully we're going to learn. So that's just, these two questions set the stage for why hormones are really, really important. Okay, so we've seen these types of facts throughout the Concussion Fix program. You've seen them online. Concussion is one of the most common neurological conditions in the world. There's issues from a symptom perspective. I'm not going to go over all of these. MRI is sometimes negative. One thing that I do talk about in terms of these facts is that there is a really strong male-female consideration and even differences. So males sustain more concussions when they're younger, less than 25. Females sustain more concussions after the age of 25. And a lot of that comes down to football and rugby are played by males primarily below age 25, and that's really increasing the numbers. And in women, soccer is the sport that has the most common or the highest chance of sustaining a concussion. Women are more susceptible, almost 1.5 times more susceptible to sustaining a sport-related concussion versus males playing the same sport. So like soccer players, male and female, women have a greater chance of sustaining concussion. We're going to unpack why this is the case and look at some of the theories. Women also seem to take a little bit longer to recover from a concussion, a little bit longer in terms of days, 4 versus 3 days, and then actually returning to their sports. So this is just data specifically looking at athletes. Quite a big difference, more than double the amount of time to get back to their sport in females, 119 days versus 45 for males. So there definitely are some male-female differences here that for us to consider. Let's look at some of the questions here. Why do women get more concussions than men? And the answer, as we've already talked about, is depends on the age. So that was that first point on the previous slide. Overall, males are more likely to be diagnosed with a concussion, but only up to the age of 25. After that, it's females. And this is just some of the data. So we've already seen this point. You can see that the numbers really change after the age of 25, looking at male and female. And now once you get up to 25 to 45, there's more females that are sustaining concussions. Why are women more susceptible than men? Why do they take longer to recover? And how does this information impact the treatment that we talk about in the course that maybe is applicable to you? So these are the key questions from that data that I've taken out, and hopefully you're asking the same questions. So women, we've already established, are more susceptible to concussions. So again, looking at some of the research there. And women do take longer to recover than men. Again, the answer is yes. We've seen this information just now looking at some of the studies here. The data is very clear, is that in this particular study in 2003, they assigned an extra 2 points in pediatric cases if a person was female in terms of their risk for sustaining a concussion. You can see here that there's an increase in females quite a bit more substantially in symptom severity and this was a study done by Dr. Cam Marshall's group, CCMI. So one of the best predictors of how fast you will recover is how quickly you see a trained concussion clinician. This is one of the best predictors. And there's some differences between males and females when it comes to actually seeking out care. Females took longer to return to school, longer to be cleared, and longer to be fully cleared to return to play. We talked about that. So this is, again, some of that research. But females it seemed that females, it took them longer to see someone for their first appointment compared to males. So 15 days versus 9 days. The researchers didn't really know the big difference for this, or whether it was they thought maybe they could the symptoms would just resolve. They maybe didn't get the best advice. They're not quite sure why this is the case, but I think the one of the big takeaways, and this may not be helpful for people that haven't sustained a concussion yet, but if you do, let's say, sustain another concussion, if you're listening to this, trying to seek out that, not necessarily your family doctor, but someone that is concussion literate. So that's a trained concussion clinician. This is usually your chiropractor. This is usually your physio that has had additional training in concussion care. This is one of the most important things a person can do right away. Even just from an education and reassurance perspective, to get some advice on what they should and shouldn't be doing in terms of physical exercise, do some sort of baseline testing where a person's symptoms are, what their limitations are, find their window of tolerance, and start the rehabilitation process. Because we now know that a person should be starting their road to recovery almost immediately. The whole idea of rest in a dark room, doing nothing until symptoms get better is very anti-evidence-based advice. The evidence is definitely very clear that you should be starting to do something. So this is just explaining and just looking at some of the research from those stats that we showed there. So the data is quite clear that there is, again, a difference between males and females. This is a little bit of a different perspective. One of the possible theories on why women sustain more concussions, better yet said, having more persistent symptoms, is that there's a difference in terms of emotional symptoms when it comes to things like sadness and anxiety. There's a large gap. If you look at these comparison graphs here, this is concussion symptoms, males and females, and concussion symptoms. This is total scores, and then individual symptom clusters. There's a huge difference in the emotional section. We know, again, this is why the Concussion Fix program has Melinda's mind-body mindfulness section first, is because the data is clear that things like anxiety and depression and mental state and a recovery mindset play an absolute pivotal role to recovery. And this data showing that girls seem to have significantly higher emotional symptoms than boys. And this could be one of the reasons why because emotional symptoms are amplifiers of other symptoms. This could be one of the reasons why, again, women are more susceptible to getting longer lasting symptoms. But everything else seems to be fairly equal in terms of the other symptom clusters. So we've already established, yes, they are. Here's a couple of theories. One of them is neck strength and game awareness. Dr. Cam covers these. If you want more information about these, go back and take a look at that end of 2020 presentation. Dr. Cam talks about that. These are two topics that are kind of in his area. And again, I want to emphasize, these are theories. Researchers still don't 100% know why this is the case, that women are a little bit more susceptible than men. However, we know that how important the neck is and how impactful neck dysfunction is on persistent concussion symptoms. There's an incredible amount of overlap between concussion symptoms and whiplash symptoms, and most often there is a neck dysfunction component to concussion cases. In fact, it's probably the most common thing that I will identify with my patients that present to me looking at, my area of expertise, which is hormones, which is diet and sleep. But I often identify necks an issue. So from an anatomical perspective, men have slightly stronger necks, and that might be one of the reasons that they can kind of slow down that impact force a little bit more, making it less damaging to some of the connective tissue. There's a concept of an honesty hypothesis. Women are a little bit more open to sharing their symptoms, and they might compare to men, where they maybe downplay the symptoms that they have, maybe score themselves less severely. Women may kind of have a just general predisposition to score themselves a little bit more harshly when it comes to symptoms, or a little more highly. That could be one of the reasons and differences. But there's a fourth theory, which is the hormonal changes or hormonal fluctuations that occur throughout a woman's monthly cycle and also through a woman's lifespan. And that's where I want to focus the rest of the presentation on. So this is, again, just setting the table on the data. So it's very clear that women are more susceptible than men to concussions. They have higher rates of concussions after the age of 25. And these are some of the theories of that. And we're going to kind of dive into the hormonal piece. So let's get everybody on the same page when it comes to hormones. Hopefully everybody listening to this has gone through the hormone module where I talk about the impact of concussions on the endocrine system. Go back and listen to that. If you haven't already, this is just a quick little review to get everybody on the same page. And even if you have listened to this, this is going to be helpful for you. So these are the main endocrine glands in the body. A gland is really just the tissue that produces a certain set of hormones. Hormones are signaling molecules that are secreted by a gland that can travel all over the body very locally. Like in the case of insulin, for example, it's secreted in the pancreas and it is just transported. It's transported throughout the body. So that's an example of a far-reaching hormone, where there's also digestive enzymes produced by the pancreas, like lipase, for example, and protease, and that breaks down things that are in the stomach, and that just goes a couple inches into the small intestine. So hormones are basically telling different tissues on what to do. They're signaling molecules. The brain is the area where the master hormone gland is, called the pituitary gland. The hypothalamus controls the pituitary, and that's the interface between your central nervous system, your brain, so things like emotions, stress, neurotransmitters. That's why the hypothalamus can be impacted by all those emotions and influence our hormones. So our mental emotional state, our central nervous system state is directly impacting our hormonal system, our endocrine system. Pineal gland produces melatonin. Thyroid, obviously, I think one of the most well-known endocrine glands, is going to be producing hormones that control metabolism. Probably the best way to summarize that. The thymus is not really involved in adulthood. It's primarily found in children, but it has a lot to do with immunity. I mentioned the pancreas, the adrenal system, which is these little glands that sit right here above the kidneys. We have two of them, one on each side. Very important when it comes to your stress hormones, and we're going to talk about that in a little bit more detail. I've talked about this in previous presentations in a lot of detail. And then finally, in males, testes and ovaries; in females, producing estrogen, progesterone, and testosterone as the three main hormones. So that gives us the lay of the land. So specifically when it comes to females, it's important to understand that hormones are not static. They're not the same level. This is obvious for any female because of the changes in cycle that they experience throughout the month. It could be 28 days, it could be 26 days, it could be 30 days. But whatever it is, this is the normal cycle. It should be regular. And the fluctuations of hormones are primarily there is estrogen, the orange line here, that's higher in the first half of the cycle, peaking right before ovulation. The blue and green lines, LH is the blue line, that's the luteinizing hormone. These are produced by the pineal gland, that is in the brain. And follicular stimulating hormone, the green line, FSH, is also produced in the brain. And they are secreted right around ovulation. And their whole goal is to allow the egg to be secreted by the ovaries, to be released from the ovaries into the fallopian tubes, and it can be fertilized. That's where progesterone increases in the second half of the cycle, and estrogen dramatically kind of decreases here. And that progesterone is responsible for the maintenance of the uterine lining. Of course, this is the ideal situation. Now, as you can see, there's two brain hormones, LH and FSH, and then there's two ovarian hormones playing a role here. And there is a very elegant symphony of all four of these hormones functioning. If LH and FSH are disrupted, then you're going to clearly see that the downstream effect is that the ovarian hormones like estrogen, progesterone are not going to be properly secreting. For example, you can see something like follicular stimulating hormone is a little higher in the first half of the cycle. It's stimulating the follicle in the ovaries. And ultimately, when that area of the ovaries is ready, it releases the egg. Whatever's left, the corpus luteum there, it's producing progesterone. So that's where progesterone goes up. So if your FSH is disrupted because of an impact to the brain, for example, which absolutely can happen, then you're going to have a disruption in the progesterone production later in the month. So all these hormones work in symphony. They're working together. We'll talk a little bit about the disruption that happens after a concussion, but I wanted to make sure everyone understands that this is the ideal and normal patterns. And of course, there's a little bit of plus and minus in what someone might consider normal. This is the same graph, a little bit more simplified. However, now there's a little bit of an added wrinkle of looking at what are some of the other types of mental emotional symptoms and cognitive changes that happen in each accompanying cycle. So for example, in the first half of the cycle, you're going to see the follicular phase women have kind of like better spatial skills. They have a little bit better memory. They have improved imagination. Remember, we just talked about estrogen being the main hormone that is secreted in the first half of the cycle, and its role is to kind of have a little bit more of the cognitive effect. That the social memory, perception, imagination, that is what estrogen is responsible for and stimulates in the brain. One of the big takeaways is that hormones have a huge impact on the brain. This is independent of actually the changes that happen after a concussion. A lot of times if you're listening to this, you might be nodding your head saying, oh yeah, you know what, I actually do feel a little bit different in the first half of the cycle compared to the second half where progesterone is dominant. Now you're going to see a little bit more of a bit more of a calmer effect, because progesterone has an anti-anxiety effect compared to estrogen's a little bit more of like an action hormone. It's a little bit more stimulating, and that's where you're going to see a little bit more of the cognitive stimulation. If you think about this on the flip side, a common time of a woman's life cycle is that in menopause, you're actually having a decrease of these hormones. So women might experience more brain fog. They might be might not have as sharp a memory and might notice that they're feeling not as focused. This could be, again, because estrogen goes down. So it's looking at what's ideal, but also there's a lot of symptoms that occur if it's not ideal. And there's lots of times, again, independent of a concussion, that these hormones can change and can trigger some of these symptoms. Estrogen, progesterone, and testosterone are the three main hormones. We talked about progesterone and estrogen already, but testosterone we should not forget about. It is important for women as well. It is typically considered a male hormone, but women also need it and have it because it also has a powerful effect on a number of key functions, primarily dopamine. So it helps improve, again, mental focus. It improves things like energy. It improves lean muscle mass with its effect on muscle growth, and also libido. Libido is a really, really important factor that often can change throughout a woman's life cycle if testosterone is low. Progesterone is a more calming hormone. It is helpful for sleep because it works on the GABA receptor. The GABA receptor is a calming neurotransmitter. Think of that as the brake through in your brain, where something like dopamine is a little bit of the gas in the brain, where you're able to kind of focus and have attentiveness and have clear-mindedness. That's primarily what dopamine does. Estrogen also increases serotonin activity. Serotonin is our kind of feel-good neurotransmitter, and typically associated when it's in low levels with depression. It's usually a symphony of neurotransmitters. It's not as simple as like just increase a ton of GABA or increase serotonin. There's a lot of other neurotransmitters. Ultimately, the takeaway is that you want to have balance. You don't want to have too high of any of these hormones. You don't want to have too high of any of these neurotransmitters. But this chart is meant to show you that estrogen, progesterone, and testosterone have an influence on neurochemistry. And we saw that in the previous slide in terms of what's happening at different times of the cycle. Just wanted to kind of point out, we talk about neurochemistry, but there's also a very physical effect of these hormones too. We could probably have a 3-hour presentation about all the different effects that estrogen, progesterone, testosterone have on different systems of the body. You know, for example, bone health. When you have low levels of estrogen, bone health goes down. If you have low levels of estrogen and progesterone, cardiovascular risk goes up because cardiovascular function goes down. And we could talk about that. But I really want to focus on the brain and specific things that might influence a person that's experiencing persistent concussion symptoms. So specifically when it comes to musculoskeletal recovery, because this is something that's obviously really relevant to people that are part of the program. They've sustained usually some sort of physical injury. Their neck is dysfunctional. They're usually doing some sort of physical rehabilitation component. Estrogen does peak, as we just showed on that graph, right around that mid part of the cycle, right before ovulation occurs. And again, one of the main reasons there is that it promotes the kind of desire for fertility. Women usually feel the highest levels of libido at that time, and they're usually looking to reproduce because that is one of the effects of estrogen. At the same time, also that estrogen peak is beneficial for muscle growth, bone growth. I already mentioned that, what happens during menopause? Well, osteoblasts, which build bone, decrease, and there's an increased risk in things like osteopenia and osteoporosis, which is the opposite, which is bone breakdown. So bone formation and also tissue and sinew collagen content. So these are things like ligaments and tendons. But at that same time, estrogen also makes your joints more lax, more flexible. Estrogen goes up during pregnancy quite a bit, and that allows the pelvis of a woman to expand so she can give birth. This is a beneficial effect. However, it's interesting when you look at the data from an injury perspective. If women sustain an injury during this time of the month, the first half of the cycle or right around ovulation, you're going to have this spike in estrogen, and they actually have an increased risk of sustaining injuries during that time. Specifically, there's a study that was looking at knee injuries, knee ligament injuries, and they found that there was this time of the month the highest rate of knee injuries. So it's kind of like this catch-22, where it's like there's some susceptibility around that time of the month. Now, we don't know about that with concussions. That research hasn't been done, but again, it could stand to reason that if you sustain a concussion during that time of a woman's cycle, there may be an increased risk for more whiplash because of the ligament laxity. But at the same time, now for recovery, getting that estrogen peak is still going to be now beneficial for muscle growth and recovery of your neck muscles, for example, of your back muscles and your tendons. So in terms of a takeaway, if you are a younger woman or you're looking to increase things like training, maybe after you recover, or you're an athlete listening to this, and you want to kind of get back to the sport that you were really passionate about playing, kind of for women that are not competing, normal cycling is beneficial. So you just want to find your balance. You want to find a normal, regular routine. And competitive athletes, there could be a little bit of an edge where when they're training, they can absolutely want that kind of like normal pattern. But if they're in competition to maybe prevent that really severe injury, there is some evidence to show that maybe that using kind of like a birth control pill, not to say that I suggest you use it from a sports performance perspective, but just kind of that regulation of that cycle, especially if it's irregular. And then in postmenopause, the evidence based on all the data that's published is that hormone replacement therapy, HRT, most likely is beneficial for musculoskeletal function, meaning it prevents muscle and bone loss. After age 40, people lose 1% of their muscle mass. And so this is a really important consideration because lean muscle mass is one of the most important factors for preventing falls and ultimately related to overall health outcomes and longevity. So lean muscle mass is one of those holy grail type things. That's why if you look online right now, resistance training is so heavily emphasized. So that's strength training, resistance training, using weights, going to the gym to do exercises that are going to move certain resistance because that's going to be beneficial for building muscle mass in a different way than doing cardiovascular exercise. So I mentioned being on an oral birth control pill, or even what's applicable here would be something like an IUD. And you have very little changes in any of the hormones. You have very regular changes because basically that hormone, which is usually a combination of estrogen and progesterone, with progesterone being a little bit higher in most cases, IUDs are primarily only progesterone based. So you're still going to get the suppression of the FSH and LH, but you're not going to be getting any of the estrogen at all because it's going to be totally suppressed. So if you're having a synthetic hormone delivered either orally or from, let's say, a patch or from an intrauterine device, an IUD, then you basically are going to suppress all your FSH and LH because they're secreted also based on the fluctuations of those ovarian hormones. So it's like this really unique cycle where the brain is always testing for levels in the blood. And if it has high levels of estrogen and progesterone, it's saying, hey, you're pregnant. You don't need to be secreting any more eggs. So we're suppressing LH and FSH, which ultimately are preparing the egg and then also stimulating its secretion. So this is what happens in a woman that is taking some sort of birth control. Obviously, one of the big takeaways here is that if there is irregularity in the period, if there's painful periods, there's going to be a regulation of those changes that happen over a month, over that 28 days. So that's going to eliminate some of those symptoms. However, you're also missing out on some of those beneficial effects when it comes to things like mood and those positive cognitive changes with those spikes in estrogen early on, and maybe some of those muscular changes, those benefits, and then some of those benefits of the higher levels of progesterone. So this is just a trade-off of regularity versus some of the kind of like peaks and valleys that are normally found in a woman's cycle that actually have some beneficial effects. And then finally, we have to talk about a really important transition in every woman's life, which is menopause. And so this happens anywhere from age 40, where you can have early menopause. It's not that common, but it does happen, most commonly around age 50. And as you can see here, you're going to start seeing changes in the hormonal pattern that looks very different than what the normal secretion looks like. And that basically is that the ovaries stop producing progesterone and estrogen. And you lose that monthly normal change. And then, of course, FSH and LH will go higher because there isn't anything that's suppressing them. And so that's why they're elevated. So blood testing will show very low levels of estrogen and progesterone, and follicular stimulating hormone and luteinizing hormone are going to be higher. That's the pattern. But I love this graph because it does show the plus and minus 5 years. Menopause, by definition, is a year of not having a period. But there's this period called perimenopause where women get a lot of symptoms that are related to the fluctuation of these hormones. I mentioned a lot of them already, but just to go over the most common ones, which unfortunately do have quite a bit of overlap with even persistent concussion symptoms. And I will say, anyone listening to this, that if you're in this period of your life, going through the perimenopausal time could be another trigger, or it could be an amplifier of post-concussion symptoms. The changes that you see on the graph here, they're irregular. And so those ups and downs that happen sometimes in the period of these 5 years, but also they happen hour to hour during the day. That's one of the reasons you're getting this hot flash, or you're getting a dip in estrogen, and you're getting this vasospasm. The blood vessels and arteries in a woman's body actually don't have this steady state of control. The estrogen fluctuates, and that in turn causes serotonin to fluctuate, and that will cause this vasodilation, and you're going to get this hot flush, and you're going to get this sweating that happens. And it can sometimes last for minutes, sometimes it can last for hours, and it can come and go and get better. There really isn't a lot of consistency. Some women have no symptoms and they go through this transition with minimal changes, and some women have severe symptoms. The severe symptoms, really, I think the thought process in the medical community for the last 20 years was women just have to suffer through this. And I'll tell you, in the last 2-3 years, that really the evidence is changing. And in fact, the interpretation of the original advice of just push through it, and all that push through it type of study research was coming from the fact that hormone replacement, which is the most effective way of dealing with these symptoms, is going to increase the risk for things like cancer, has been majorly overblown. It's been majorly overemphasized, and women have been needlessly suffering for the last 15-20 years because of a lot of that recommendation. So the latest evidence is that hormone replacement therapy can be very beneficial to minimize some of these symptoms and has very minimal side effects. Of course, this is a conversation to have with your primary care provider. And sometimes women get stuck with providers that are just unwilling to do any sort of prescribing. And this is where working with a naturopathic doctor or functional medicine doctor can really be helpful, because ultimately the severity of symptoms can really impact a woman's quality of life. And so if you are one of those women that are really struggling, or you're in the future, you're going to go through this and you have a lot of symptoms that are disrupting your sleep, that are disrupting your ability to basically function on a daily basis, using botanicals and lifestyle changes to start is a really good idea, and then moving to hormone replacement therapy could be options for you. And so what that does is that kind of just creates a little bit more of stability. You're not going to get these major ups and downs through this period of time, and the hormones will go down over time, but the idea is that it just gives you this more steady slope down to the point that your ovaries stop producing estrogen and progesterone totally, and you are in postmenopause. Since we're talking about menopause, the loss of estrogen and progesterone are the two main kind of hallmarks. And so here are some of the symptoms. I've listed them out. A lot of them actually overlap with many symptoms in PCS. So foggy brain, depression, anxiety, mood swings, things like headaches, memory changes, menstrual irregularity, of course, sleep issues. The ones I just listed are common PCS symptoms. So there is a lot of overlap here. So women that are going through PCS and also perimenopause, I think this is a big area that probably should be looked at by their healthcare providers and maybe offers an opportunity to stabilize hormones, and which also may reduce symptoms, sometimes dramatically in some women. Estrogen is strongly connected to brain health. I want to emphasize this. One of the big takeaways is that when we're thinking about PCS recovery, our central nervous system, our brain is obviously front and center. Even though there isn't anything damaged in the brain, as we've identified through the Concussion Fix course, there's a lot of impacts of hormones on brain function. And estrogen is so strongly connected that researchers have found that it plays a key role in the risk for dementia. Women have a 2-to-1 chance of getting the diagnosis of Alzheimer's dementia compared to males. And again, the idea is that the loss of estrogen may be one of the driving factors. Again, it's one of them, but it's a big one. Early menopause, which means that you have loss of estrogen earlier in the body, earlier in a woman's lifespan, I should say, and you're missing 5, maybe even 10 years of estrogen. That estrogen's protective effect on a woman may actually speed up degeneration of the brain. Now, I want to be clear that I'm talking about Alzheimer's dementia here. I'm not talking about PCS, and I'm not saying PCS causes dementia. I want to be very clear about that. Dr. Marshall has done a good job of summarizing that evidence. There are some changes that happen after a concussion, like neuroinflammation and changes to blood flow in the brain that are temporary, but they do have some overlap with some of the changes that researchers have found in dementia and degenerative conditions. That doesn't mean that both of those are the same, but it does tell us that there's an opportunity for us to heal the brain, to decrease inflammation and decrease some of the processes that possibly could speed up a condition like this, especially if a person has family history. And there is a strong kind of family history connection with dementia. And if a person is concerned about this, they do have that family history and they want to optimize their brain function. You're listening to this and you fall into that category. Hormones actually have a really important role to play. Dementia starts happening decades before symptoms actually start. So the diagnoses often happen in a person's 70s and 80s. However, the process researchers have found is happening 20 years before that. So in their 40s and 50s, already some of these changes. And it's multifactorial, but hormones are one of them. Up to 80% of women are vulnerable to neurological changes and symptoms that can occur during perimenopause, which means if you're going through menopause, there's a strong chance you're going to get some brain symptoms. So there definitely is a strong connection here. I thought this was a really great diagram, just showing the effects of estrogen on risks of dementia. So, for example, there's a lot of things that is kind of like equal. For example, something like having 5 kids. Could there be higher risk? There's no risk or lower risk. So, first takeaway is that the research isn't cut and dry here. There's lots of benefits on both sides of the fences, but there are some that are pretty clear. For example, earlier menopause, 56% of the studies. So this is looking at the evidence, the body of evidence that's been published. So this is not looking at a particular research study. So this is a paper that looked at all the studies that have been done, and majority of the evidence, 56%, showed that there's a higher risk of dementia if a person goes into early menopause and also gets surgical menopause, which is something like a hysterectomy. So I included this graph, not that it's related to concussions, but more so if a person is falls into one of these categories in terms of a risk factor, and they're looking to optimize their brain health and ultimately reduce the risk for future neurological issues, this could be helpful for us. Interestingly, I mean, you can look at some of these individually, so I'll let you do that on your own. But, having later age at menarche means that you get your period for the first time at a later age. Majority of it shows no association there, so that really is not something we can kind of get any sort of data per se from. Hormonal contraceptive use seems to be, very balanced between a slightly lower risk and also no association whatsoever. But I think the overall takeaway is that if you have less estrogen in your life throughout your life for all these different reasons, there's a slightly increased risk for degenerative issues in the future. Okay, progesterone. So if estrogen's the kind of yang hormone, the yin hormone, the balance is progesterone. They work in symphony together. It's not just in isolation. And progesterone kind of has this really neat counterbalancing effect and complementary effect to estrogen, where it's kind of like the calming effect. If anyone knows anything about Chinese medicine, yin is kind of like the grounding and calming force. Progesterone has that yin effect. It maintains uterine lining. It prevents excess buildup. If you have tons of progesterone, if you have tons of estrogen, then you're going to have a lot of growth of uterine lining, where progesterone is going to maintain uterine lining. It's going to prevent the overgrowth of it. It normalizes blood clotting while estrogen increases blood clotting, which is why doctors recommend not to smoke when a person's on the birth control pill, because you're getting estrogen all the time. You're not getting a big peak, and then you're not getting that valley in the second half of the cycle. It promotes normal sleep patterns. I've seen hormones impact migraines. If your headaches are worse at a certain point in your cycle, that is one clue to say that your hormones at least have a role to play in the genesis of your migraines. Sometimes I'm thinking of a recent patient right now. She's a 15-year-old female, sustained a concussion by getting hit in the head with a ball. She had migraines before the concussion, but everything got substantially worse after. She has both chronic daily headaches, which primarily have a lot to do with neck dysfunction and cervicogenic related conditions, more inflammatory in nature, and blood flow, where migraines are more related to hormones. Sometimes they're related to reproductive hormones. Sometimes they're related to things like serotonin in the brain. Not every migraine is hormone related, but if you're noticing that it gets worse around your period, that is a key sign that it may be related to hormones, and a full hormonal assessment should be completed. The big takeaway for progesterone and estrogen when it comes to PCS is that it is calming in nature. So anxiety and insomnia are the two most common things to think about over and above the balance of estrogen and progesterone, as I just talked about in the context of migraines. Now, the final thing to think about here is, as I mentioned, it's all about balance. There's a fairy tale called Goldilocks. I have 5 young kids, and so of course I read a lot of these types of books. And if anyone remembers this fairy tale, it's this bed is too hard, this bed is too soft, this bed is just right. So it's that Goldilocks effect with hormones. We don't want too high, we don't want too low, we want the right amount. We want the balanced effect. And so this absolutely applies to estrogen and progesterone. If you have too much estrogen and not enough progesterone, there's something called estrogen dominance that can happen. The opposite, too much progesterone and not enough estrogen, is rare. It can happen, but it's a lot less frequent. It's much more common to get the opposite. The other thing to consider here is that In our environment, there are many more factors that increase estrogen exogenously, meaning outside of our bodies, than it impacts progesterone. For example, many chemicals, many environmental pollutants. For example, there's a big push in the evidence and research right now to look at the effects of what are called microplastics, these tiny particles of plastics that actually come off containers that contain plastics, wrappings, bottles, and microplastics have a very mild estrogenic effect. Hormones are found in animal foods. For example, dairy products have the highest level of hormones because it's an animal. You're consuming milk, which is meant for a baby cow. So of course there's going to be hormones present in it. Not to mention sometimes hormones are added to it. So there's a lot of environmental stressors that are pushing a higher level of estrogen. When you have a high level of estrogen, it's going to counterbalance the effects of progesterone. It's going to counterbalance the effects of testosterone, especially in males. So we want to have the just right Goldilocks effect for both estrogen and progesterone. So in my experience, we have to look at both. And in situations that are not menopausal, so I'm talking now premenopause, so the 15 years old to 45-year-old category, it's much more common to have an imbalance of too much estrogen and not enough progesterone, where in menopause, it's more common to have a decrease in both estrogen and progesterone that's causing symptoms. So I just wanted to make sure that I touch on both common patterns in the different age cycles. And this can present with a lot of common symptoms. So like increased PMS, increased fibrocystic breasts, ovarian cysts, water retention, changes in menstrual regularity and menstrual bleeding. Heavy bleeding is a really common estrogen excess versus progesterone deficiency symptom. Something to consider and think about in context of your current symptom state and in the context of PCS. So in summary of our kind of like crash course on hormonal physiology 101, estrogen and progesterone have synergistic neuroprotective effects. The neuroprotective effect of estrogen changes over the lifetime, and it's not like more is better. That's where it says it's consistent. In some cases, it could be helpful, but in some cases, like the estrogen dominance, we have to decrease it or increase progesterone to rebalance it. Oftentimes, birth control pill is a kind of like a crutch or a brace to balance things that are out of balance, and it has a role for certain women that really have tried a lot of things and they haven't been able to control severe PMS symptoms or severe menstrual bleeding, symptoms that are present pre-menopausally. The lack of estrogen and also progesterone, but specifically estrogen when it comes to brain health, could be an increased risk for some more neurological conditions and also neurological symptoms. Mounting evidence suggests that hormone replacement therapy may be helpful to protect from some of these hormonal changes and reductions, but you have to have a personalized risk assessment. So don't take away, Dr. Paul thinks everybody should be on hormone replacement. No, that's not the case. What I am saying is that hormone replacement may be beneficial in some cases for women that have a demonstrated deficiency, both from a symptom perspective and from a lab testing perspective. And many times, historically, especially when it comes to the effects on brain, doctors have been hesitant to prescribe the effects of hormones, and they've been overemphasizing the pro-cancer effects of hormones. That is now shifting the evidence, and the hormone replacement therapy can be a valuable temporary solution for people that have hormonal issues and also PCS symptoms. We've talked about in my module in the course and in that specific hormonal lesson that TBI can disrupt hormone levels. Sometimes it's temporary. Sometimes this can be a slow onset and be long lasting. And so why does that happen? Well, I think we talked about and already discussed the impact of the pituitary gland. The pituitary hormones are produced in the pituitary gland that's, again, found really close to the center of the brain. And you can see all these cascades of hormones. So these fine little blood vessels can be impacted by inflammation. It can be impacted by oxidative stress after a concussion, and definitely can be impacted by changes in blood flow. We know that blood flow changes after a concussion. So this is why maybe temporarily hormones can change, but also what if that blood flow issue continues? What if that inflammation continues? This is now setting a person up for longer term hormonal issues. So this may be one of the reasons that women are more susceptible, going back to that question. And specifically, researchers have looked at maybe it's the lack of progesterone that happens, again, after that shock to the pituitary gland. That lack of progesterone, again, progesterone having this neuroprotective effect, estrogen has a neuroprotective effect. The concussion can temporarily disrupt those hormones, and that will impact a woman's menstrual cycle. And there's some evidence to say that getting an injury at a certain part of the cycle, it maybe predisposes women to more of a longer term symptom. I think that the evidence here is still way too preliminary to really put any sort of stock into. Also, anybody listening to this, I mean, really, what does this matter? Because you've sustained a concussion. You might have got it in the second part of your cycle or first half of the cycle. Either way, you have to correct the hormonal situation that you're currently in right now. Going back and trying to think about, what part of the cycle was in, that I don't think that makes a big difference. But I wanted to include this just to show you that there is some researchers looking at this, and I'm not so sure it's helpful for the people that are listening to this. It may be more helpful from a preventative perspective. Again, going back to the idea that, maybe if you're participating in a really high risk concussion sport and you're in competition, that's where, using a hormonal intervention like birth control may make a woman less susceptible. That is a separate conversation. You've seen this slide on in the actual lesson. I've shown that 16% of people sustaining a mild traumatic brain injury, aka a concussion, develop a new pituitary hormonal dysfunction over 6 to 12 months. Now, this is so key to understand. We looked at that little pituitary gland and those tiny little hypophyseal blood vessels. Those are really, really micro capillaries and blood vessels. They can easily be disrupted, but it's not like that's totally cut off. In more severe brain injury, you can see that the rates actually go up much higher. It's up to 50%, almost 60% in some cases. The more severe the hit, the greater chance for major disruption. However, most people that are listening to this have sustained most likely a mild traumatic brain injury. And so now the incidence is lower, but the longer term effect is still there. It's key that this was not developed a pituitary dysfunction in the next 2 weeks after a concussion. No, this was up to a year after or even more. And so this means that the effect can come on slowly. So this is so confusing to a lot of clinicians because it's so hard to differentiate. Is this just the progression of a person's symptoms, or is this actually hormonal dysfunction? That's why we absolutely emphasize getting testing done. If you have the symptoms that could be related to hormonal dysfunction, then I think evaluating it, especially if a person's not making progress in their recovery. If you're listening to this and you're noticing that new symptoms are coming up, you're getting more fatigued, you're not being able to recover, you're doing all the right things that have been talked about in the Concussion Fix program, you're working with a concussion literate provider, and you're totally stuck, this could be one of the reasons that a person is stuck in their progress. So hormonal symptoms post concussion. Growth hormone can become low, and that's related to mood changes, memory changes. One of the most common things I've seen in my practice is kind of this brain fog that doesn't really change no matter what you're trying to do. And also your body composition can change. So it can be a decrease in muscle mass because growth hormone is so important when it comes to body comp. Weight gain could be another one. Low gonadal hormone production. So in males, it's testosterone, but in females, it's estrogen, progesterone. We talked about that. Menstrual changes, and it could be any type of menstrual change and associated symptoms. Mood changes, anxiety, depression, those are really common ones. And there are other ones, but those are the main ones. Thyroid usually becomes low, not so much high, but usually becomes low. It can become a hyper in some cases if an autoimmune condition is kind of triggered after, but most common it's a hypothyroidism, which is going to be related to fatigue, constipation, weight gain, low mood, headaches, muscle pain. There's a whole host of symptoms, and basically it's like your whole metabolism's turned down. This one is fairly easy to test on blood work, and usually primary care providers are pretty good at that. They're very poor at testing growth hormone. They're very poor at testing adrenal hormones. They sometimes will test estrogen, progesterone if a woman will say, hey, I got some menstrual issues. We'll talk about that in a couple slides here. And then lastly, adrenal hormones. And this is where I spend a lot of my time because it's just so poorly covered in conventional medicine. And this could be low or high, very equally one or the other. Fatigue, blood sugar changes, insomnia, changes in blood pressure, changes in orthostatic hypotension, changes in blood pressure on postural changes, really strongly connected to things like POTS, abdominal weight gain, or inability to gain muscle mass. There can be metabolic changes. It's one of the hardest ones to navigate because the symptoms are so vague. They can be related to a lot of different things. But the presentation of the symptoms together makes it a lot more clear when you look at it with somebody that actually knows what to look for. So that's where working with a naturopathic doctor or functional medicine doctor is really helpful. Other endocrine conditions can present before concussion or can occur during the recovery process. So we talked about menopause already. Women that are going through menopause, it's just another complication of hormonal changes that can make symptoms worse. So sometimes correcting those hormonal changes, maybe even using hormone replacement therapy temporarily, can really help allow the brain to get into a neuropermissive environment to heal, to allow that healing to occur. Even though the concussion may not have caused menopause, a lot of people ask that question, it's possible that it just jolted the pituitary gland into producing less of the hormone more quickly. That is possible. More commonly, it's women are going through perimenopause and they sustain a concussion, and then it amplifies symptoms. I've worked with quite a few women that have been wanting to get pregnant, had a concussion, and then got pregnant. We help them with infertility after getting pregnant, after sustaining concussion. And so there are considerations around pregnancy, but generally speaking, sometimes fertility can be negatively impacted after a concussion because of the hormonal changes. But in the case of fertility, that is one area where people are usually working with expert in fertility and hormones. So their hormones are getting tested and looked at in my experience. So that is one area. And so people are not looking at that for a concussion, but it's allows you a window into the conventional medical system to actually respect hormones. PMS, mood issues after, during changes. This is really common in that kind of 15 to 45 age category. Absolutely can be experienced, often temporary in women. After a concussion, so they'll get a couple months where they get menstrual changes, and then it'll kind of rebalance after that. PCOS, polycystic ovarian syndrome. This most likely is an underlying condition that was present before a person sustained a concussion, and it's usually there's a hallmark of having high levels of androgens, which is a certain type of hormone. So testosterone is an androgen, but there are some other ones like DHEA. There usually is an adrenal component to it. There definitely is a blood sugar component. And the high levels of androgens usually manifest as Things like being a little overweight, not able to lose weight, male pattern hair growth, male pattern hair loss. These are some types of symptoms, and that needs to be treated. And again, like menopause, can pose an additional issue when dealing with PCS symptoms. I'm just going to skip through some of this because I've talked about it in the modules, but I just want to remind everybody that after a concussion, this is after an acute concussion, within 7 days, there are hormonal changes that happen. So in most cases, they're transient, but in some cases, they can be exacerbated. And again, the trend is high prolactin, low progesterone, low DHEA that happens again right after a concussion. And so progesterone is one of the hormones we talked about, and there actually is there's so much data back in the early 2010s that there were some large-scale clinical trials doing progesterone as an IV therapy right after a traumatic brain injury. Now, to be fair, this was not concussion. This was more severe brain injury. It was done in hospital settings. It was done right away. And so they were trying to look at progesterone like a drug. How can we use it to decrease inflammation? How can we use it to have it sustain and capture its neuroprotective effect? Now, we just learned about the effects of progesterone in terms of a woman's hormonal cycle. So we're not thinking about it from this perspective. And ultimately, the conclusion in 2016 and 17 was that there really was no benefit to doing this versus placebo. And I think that kind of makes sense because progesterone is never meant to be produced in massive amounts in the body. And I think that, even there was some critiques in 2017 by Dr. Howard's group saying that they didn't do it for long enough. They kind of just did it like a drug, like, can we just intervene with it? And that's not the way progesterone is meant to be used. So I think that progesterone still has a lot of viability used as a long-term balancing approach, not for a couple days after a concussion. These are some of the changes that happen hormonally, and there's some unique kind of patterns that happen after a concussion. Depends on the types of symptoms that you have. So this is acute concussions. Somatic is more like body symptoms. Cognitive symptoms are more, again, memory, brain fog, that's fatigue and emotional. And so you see a decrease in progesterone is across the board in all of them. And cortisol is a really important one. And cortisol is your master stress hormone produced by the adrenal glands. And those are the glands right here above your kidneys that are, again, secreted and stimulated through the anterior pituitary, just like we saw that little hormone in the brain. Looks like a stalk in a bean. And this is responsible for producing cortisol, DHEA, epinephrine, and aldosterone. And what happens after a concussion is that there is a decrease in cortisol, as you saw in the acute concussions, but that's just right after a concussion. What that might cause is that it kind of is like a domino effect. It affects all these other hormones. So the adrenal system has this powerful effect on all the other endocrine systems, more so than any other hormonal system, because it's directly related to stress. So if a body's under stress, it's going to downregulate estrogen, progesterone, because think about it from an evolutionary perspective, we don't want to be reproducing when we're under a lot of stress. That was not advantageous from an evolutionary perspective. We don't want to be making bone during a high amount of stress. We want to be supplying our lungs and our heart with fuel, glucose, and we want to have optimal blood flow. We want to decrease inflammation. That's what cortisol does. So there is a decrease in cortisol. There's an altered stress response. But then in the subsequent weeks and months after, you can have a high level of cortisol because the stress continues and the adrenals recover, and now they start responding to that cortisol. And if that stress continues, you have high levels of cortisol that can turn into low levels of cortisol eventually too. So this can absolutely affect a woman's hormonal cycle at any part of their life. And in fact, one of my big focuses and missions is to really emphasize how important the adrenal system is at all ages for women and how important it is for everyone that's experiencing PCS and even related conditions like things like POTS. How does all this inform what we need to do? So I want to finish off by talking about takeaways. So we talked about changes to the menstrual cycle are usually temporary. So now that we've looked at all this, I want to make sure we bring it back to, okay, so what can people listening to this apply to their own situation and ultimately help their recovery? Even though we talked about all these really powerful ways that hormones are changed after a concussion, it's important to understand the body is really, really elegant at retaining and restoring balance. It wants to go back to homeostasis. So the vast majority of cases, hormones will normalize over time, usually within the first couple months after a concussion. And anyone listening to this and anyone that's experienced concussion can probably attest to this, is that, you know, they might have experienced a hormonal menstrual cycle change the month or two after this state of concussion, but then it usually goes back to normal. That's been my experience. Now, there's a small percentage of women that it doesn't go back to normal, or in fact, it gets worse. And that's the group of women that hormones should be your priority to address. Pre-existing hormonal states, like, for example, PMS, like infertility, like PCOS, like perimenopause, may be an area of vulnerability for PCS symptoms. So what should you do? You should evaluate any new hormonal symptoms after a concussion. So you talk to your primary care provider, and they usually will do a referral to a gynecologist. Now, here's an important takeaway. Call it a clinical pearl based on my experience. If you go into your family doctor's office and say, I just listened to this Dr. Paul guy on this Concussion Fix program, and he said hormones are changed after a concussion, you will probably get totally dismissed, because primary care providers have not been educated on the relationship of concussions and hormones. Even endocrinologists, which are experts in the hormone field in the conventional medical system, they often have not even heard this before, and they will be dismissive. So the approach that I recommend that you take is that if you, after listening to this, think that there could be some hormonal issues, you go to your primary care provider and you focus on and talk to them about those hormonal issues. Dr. So-and-so, I've noticed that my hormones have been really off in the last little bit. And don't even say hormones. Say my menstrual cycle has been really off. I've been feeling really depressed around my period. It's been heavier. Whatever the symptom is, that's what you want to focus on. And then the provider is going to say, oh, okay, even if you don't even mention the concussion, you in your mind know that the concussion is a possible culprit, but don't even mention the concussion, because as soon as you say that, they know you've been on Dr. Google, and they're going to have an increased chance to dismiss you. Unless you have a really with it and evidence-informed provider, you're probably going to get dismissed. The full panel of testing to look at hormones is listed here. You can definitely ask for a full hormonal evaluation, especially if you've felt out your family doctor and they're open to the connection of hormones and concussions. You might even start with a question being like, hey, I've really noticed I've been off hormonally after my concussion. Is there a chance that we could just check these hormones? And if you want, you can give them a list, even the list that's listed here. They'll probably be able to do some of them, but I very commonly see that growth hormone is not done. Sometimes even prolactin is not done unless there's a real change in a woman's menstrual cycle. Growth hormone is super poorly understood. And I often see this list given to providers and some of it being tested, but not others. You have a stronger case when there's a symptom connection to it, like, oh, I have no libido after my concussion. Well, that's a testosterone problem. My menstrual cycle is totally off. Well, that's an LH, FSH, estradiol, and progesterone problem. If you tie it to those symptoms, you have a better chance of getting the testing. Growth hormone, I've listed it here just for completeness sake. It is one of the most common deficiencies, and unfortunately, it's very, as I mentioned, very poorly understood. Endocrinologists are really the only ones that can test it. I've never seen a family doctor run this. And it's one of those things that you do all the other evaluations first. And if you still, after correcting those issues, if there are any, you still have symptoms, that's when you hopefully need to get referred to an endocrinologist and they do the testing. And then ultimately, if you want to do that from a conventional perspective, then you also want to work with a provider in the holistic health space, a naturopathic doctor or functional medicine doctor, because they understand hormones like I've described it, and now are going to be also guiding you from that perspective. So you kind of need to have one foot in the box, in the conventional medical box, and then you also need to have one foot outside the box, because there's pros and cons to each one. There's some testing that you could only get through your conventional endocrinologists and doctors, and there's some testing that is only going to be helpful that you can get outside the box. And there's treatments on both sides too. So I'm not, even though I'm a naturopathic doctor and I operate outside the box for the most part, I really strongly advocate don't cut any ties on either side. You kind of need to use both. So the pyramids, we like to use pyramids here with the Concussion Fix. The pyramid for assessing hormones and treating hormones and restoring hormones is assess and test first, then implement the Concussion Fix program. This is super key. Remember I mentioned the body wants to rebuild and restore its homeostasis. That is the default mode. It wants to heal. I can't tell you how many cases I've seen where we haven't had to give somebody hormones. We've just had to change their mindset, regulate their nervous system, decrease inflammation, clean up their diet, and start a proper exercise rehab program, and their hormones get better. Do those things first, and the body's homeostatic mechanisms will kick in. Then if you've done step 2 and you still have hormonal symptoms and you're not getting better, you've plateaued, then you can start exploring hormone replacement. You could probably substitute assessment and testing with the mindfulness diet and the Concussion Fix program, one or the other. I recommend getting the testing done right away, because there are some rare cases, maybe not rare, but less common cases where you might need to go directly to the hormone replacement. An example would be your thyroid is dysfunctional. And if your thyroid is low and there's no amount of meditation that's going to change that. Now, it might help it a little bit. It might allow that healing process to happen, but you do kind of need to replace that hormone. The same thing would apply if you're in menopause and you have a lot of hormonal symptoms. You might need to do hormone replacement along with also doing the Concussion Fix program. Okay, and that ultimately will culminate to the restoration of endocrine function when you kind of look at this from a personalized perspective. In the Concussion Fix program, we give you a list of hormones that you can share with your family doctor. This is part of the blood testing, the comprehensive blood testing. We've had so many questions about this that we've created a document that is available in the resources that goes over the most common hormones that can become dysfunctional and other metabolic factors. So hormones are only a part of this. Many of these tests are standard tests, like for example, something like vitamin B12 and hemoglobin A1C and a complete blood count. These are standard things. So they're checking for B12 deficiency and vitamin D deficiency and iron deficiency. But a lot of these, other than the ones I just mentioned, the rest of them are all hormones. So hormones play a huge role in blood testing. If you can't get this blood testing done, I'll show you how to manage that. I've already shared with you how to approach it with your family doctor. And the document also goes over all the different reasons. So it's designed in a way that you can literally hand it to your family doctor. Now, again, like I said, a lot of family doctors don't love that. They don't like being told what to do. Some of them that are truly still in it for the right reasons and are still engaged with patients' best interests, they will look at it and they'll read it over and realize it's really evidence-based. We list all the references And they might say, sure, you know what? I care about my patient. I'm willing to do this test, even though I may not really understand it, but this might be an area I'll consider. So use that document to your benefit. There are other types of tests, like a dry urine hormone test or saliva test, to name a couple of them, that are outside the conventional blood testing category that can be helpful. So this is an example of one of the tests that I did with my patients. And so we're looking at estrogen, progesterone, but we're doing it in a way that's complementary to blood. So it doesn't necessarily just replace blood testing. It also double checks things like adrenal hormones, which are really inaccurately tested in blood. They're good at testing, like, is a person incredibly high or incredibly low, but it doesn't pick up all the gray areas where you can absolutely be symptomatic and but not get it picked up on blood. So I'm not going to go over all this in detail. I just want to show you that there is some outside the conventional system testing that's complementary to that testing. And ultimately, you want to create a personalized approach that's going to address hormones. That basically is the Concussion Fix program. I talk about this in detail. So the best first step for anyone listening right now, if you've suspected any hormonal issues based on what I've shared with you today, do the Concussion Fix program, apply it to the best of your ability, go back and take a look at some of the resources that I've created and the other educators have created on the specific area that you're struggling with. If it's stress, then look at that area. If it's sleep, look at that area and make sure you apply it all. And ultimately, the body wants to get back to homeostasis. It truly does. And when you are able to, restore some of those foundational pieces, the endocrine system will start to rebalance itself in most cases. Okay, Nikki, I think that's going to be good for now. I do have some more Q&A, but we're already over time here, and I see there's a ton of questions here in the chat.